Rent or meds, Americans choose daily. This sounds like a tough choice, and unfortunately it's becoming increasingly common in many parts of America today due to rising costs of living. Let's start with housing costs. The average American spends about 30% of their income on rent or mortgage payments. That's roughly $1,000 a month for someone earning an annual salary of $40,000. Now think about that number, one paycheck lost to just your home. But here's the twist. While housing costs have been rising steadily, prescription drug prices have increased significantly over the past decade. In 2015, the average monthly cost for a brand name medication was around $375. By 2021, that same drug could cost nearly $640. So, let's do some math. If someone earning $48,000 spends $1,200 on housing each month, and then needs to pay $600 for prescription drugs, they're already spending 1/3 of their monthly income just to stay healthy and have a roof over their head. Now here's the kicker. This isn't just about one drug. For many people with chronic conditions like diabetes or high blood pressure, they often require multiple prescriptions each month. The total cost for these medications can easily exceed $1,000 monthly. Imagine you're a single parent earning a fixed income and struggling to support your family while facing the unexpected costs of healthcare. It's not just about maintaining health, it's about basic survival. So why is this happening? In part, it's because prescription drug prices are largely unregulated in the United States. Unlike housing, which can have local rent control measures or federal assistance programs like Section 8 to help manage costs, there's very little government intervention when it comes to pharmaceuticals. Now let's break this down step by step. 1. Housing costs. The average American spends around $1,000 a month on housing costs. 2. Prescription drugs. Prescription drugs can vary widely in cost, but for some individuals, the monthly expense might be around $600. That totals up to $1,800 just for housing and drugs alone. If you're earning only $48,000 a year after accounting for those expenses, you would have approximately $3,200 left over each month for everything else, such as food, utilities, transportation, and savings. Wait, there's more. Many people do not have access to health insurance to cover these costs. Without insurance, individuals must pay for every prescription out of pocket. This means that any unexpected medical expenses can quickly lead to a significant financial burden. So here's a question. How do you prioritize between the affordability of housing and the cost of prescription drugs? You might think there's no choice at all, but let's look closer at the data. Housing costs have been rising steadily since around 2010. In many cities, rent prices increased by over 50% in just a decade. Prescription drug prices have also risen significantly. For example, the price of insulin, a life-saving medication for diabetics, more than doubled between 2012 and 2021. Now let's talk about one concrete number, $10,000. If housing costs and prescription drug expenses consume half of your annual income, that means you could potentially be losing the equivalent spending power of $10,000 each year on other essential needs or savings opportunities. But what can you do? Here are some steps. Budgeting. Track every penny spent on both housing and medications to see where you can cut back and allocate funds more effectively. Government programs. Look into local assistance programs like SNAP or Medicaid, which might help cover the costs. These programs vary by location and eligibility requirements. Generics. Opt for generic versions of your medications whenever possible. They often cost significantly less than brand name drugs while providing similar efficacy. Now here's another question. What if everyone faced these same choices? If every American family had to choose between affording a home and accessing necessary medications, it would underscore the significant flaws in our healthcare system. This highlights the urgent need for meaningful policy changes to ensure both housing and prescription drugs remain affordable for all Americans. But for now, let's focus on the immediate actions you can take. Community resources. Local clinics often provide free or discounted prescriptions. Pharmacy discounts. Some pharmacies offer substantial discounts on brand name drugs for qualifying individuals based on income level. Financial aid from manufacturers. Many pharmaceutical companies offer financial assistance programs to help those who cannot afford their medications. These options can be a lifeline for many people. However, the real solution lies in systemic changes such as regulatory reforms and increased competition to address the affordability of prescription drugs compared to housing costs. 1. Regulation. Government intervention is necessary to regulate prescription drug prices. ensuring they're fair and accessible to all consumers. 2. Affordable housing programs. Increase funding for affordable housing initiatives to help keep rent costs manageable for low-income households. 3. Healthcare reform. Advocate for policies that make health insurance more comprehensive and less costly, thereby improving access to essential medications. Now let's dive into some historical context. In the early 1990s, prescription drug prices were generally lower than they are today. For example, in 1995, a vial of insulin cost around $25. Currently, the price for an equivalent vial can exceed $300. And here's another comparison. In countries with universal healthcare like Canada and many European nations, prescription drugs are often significantly more affordable. In some cases, certain medications may be fully or partially covered by national health systems. The answer lies in the structure of our healthcare and housing systems. Lack of price controls. Unlike housing or utilities, prescription drug prices are not subject to government-imposed price controls at either the federal or state level. Pharmaceutical industry influence. Major pharmaceutical companies exert substantial political influence, often hindering the implementation of regulatory reforms that could reduce drug costs. But there's hope. Movements like Medicare for All and proposals for price caps on prescription drugs are gaining traction. These changes could mean a future where everyone has more equitable access to essential healthcare, including medications and potentially housing support. Now let's take a closer look at some key considerations. Generic drugs. Switching to generics can significantly reduce monthly medication expenses, often by hundreds of dollars annually. Pharmacy negotiations. Some pharmacies offer substantial discounts if you negotiate directly or utilize patient assistance programs. Insurance options. Consider high-deductible health plans with Health Savings Account (HSA) contributions to help manage out-of-pocket costs. These strategies can provide some relief in the short term. However, the real solution lies in systemic reform. 1. Policy advocacy. Support candidates and policies aimed at regulating prescription drug prices. 2. Community engagement. Join local organizations that advocate for affordable healthcare and housing initiatives. So here's what we've learned. While it might seem challenging to balance high housing costs with expensive prescription drugs, there are concrete steps individuals can explore to potentially ease this financial burden. But remember, systemic change is the ultimate solution. Policies are needed to ensure that everyone can afford both a safe home and necessary medications without financial strain. So what's your next step? Start by exploring local resources and considering generic drug options. When you're ready, think about advocating for policy changes in your community. In short, don't wait for change to happen. Take steps now to secure your financial health today and work towards a better future tomorrow. This is educational and historical, not financial advice. Let's explore the concrete steps that can be taken and why systemic changes are crucial in addressing the affordability of prescription drugs versus housing costs. First off, explore local resources like community clinics or government programs. Many cities have initiatives where residents can obtain prescription drugs at a discounted rate through partnerships with pharmacies and drug companies. For example, some places offer programs for seniors and low-income individuals to access essential medications such as insulin or treatments for chronic diseases without incurring excessive costs. Another key step is to prioritize generic drugs over brand names whenever possible. Generics are typically 30 to 85% cheaper than their branded counterparts, offering the same effectiveness at a significantly lower cost. For instance, if you're on an expensive cholesterol medication, check with your doctor about switching to a generic version that offers similar benefits without the hefty price tag. Additionally, consider signing up for prescription discount cards or manufacturer assistance programs. These options can help reduce costs significantly and often complement insurance plans to enhance savings. Many pharmaceutical companies also provide patient assistance programs through which income-eligible individuals may receive their medications for free or at a reduced cost, which help low-income families secure affordable homes by subsidizing rent payments. These programs typically have strict eligibility requirements and are worth exploring if you're struggling with high housing costs. But here's the kicker. While these steps can help alleviate immediate financial burdens, they don't address the root causes of rising drug and housing costs. Systemic changes are necessary to ensure that everyone has access to affordable healthcare and safe housing. Advocating for policy changes in your community can be an effective way to address issues such as the affordability of prescription drugs and rising housing costs. Contact local representatives to share your experiences and concerns. Consider organizing or joining advocacy groups that work towards legislation like price caps on essential medications, rent control measures, and increased funding for public housing initiatives. By speaking up and engaging in grassroots efforts, You can help push for the kind of systemic changes needed to ensure that everyone has access to affordable healthcare and safe housing. This isn't just about personal financial health. It's about collective well-being and securing a better future for generations to come. In short, explore local resources and generic drug options, but do not stop there. Advocate for policy changes to secure a better future for all. This is educational and historical, not financial advice. When you talk to your representatives or join advocacy groups, it's important to back up your arguments with data and personal stories. Share how prescription drugs have affected your finances and health, and highlight the stark contrast between the high costs of medication and the rising housing prices in your community. For example, many people struggle to afford even a single month's rent, while also covering their medication expenses. A 2019 survey found that nearly one-third of adults aged 50 to 64 had skipped necessary prescription drugs due to cost, often choosing between paying for food and healthcare. This isn't just about short-term financial strain. It's about long-term health consequences. Moreover, housing instability directly impacts access to medical care. People who are homeless or live in substandard conditions face greater health risks and find it harder to manage chronic illnesses. Addressing these issues through legislation, such as implementing rent control measures and increasing funding for public health care, can help mitigate the cycle of poverty and poor health. Remember, systemic change doesn't happen overnight. It requires persistent effort from individuals like you who are willing to speak up and advocate for better policies. Keep your representatives informed about local conditions and encourage them to prioritize solutions that benefit the entire community, not just those with financial advantages. Affordability struggles tie together in complex ways, affecting every aspect of daily life. Understanding these issues can help shape future policy decisions that address such concerns. Tomorrow on the Money Files, understanding productivity and labor costs. This is educational and historical, not financial advice.